Our group is working on the business process flow analysis of Tonghua Group of Hospitals, Feng Yuking Hospital. It is an old hospital and still uses traditional means to dispense the drugs. This is the explanation of the process flow. Firstly, the patients will wait in the reception and then enter a doctor's consulting room. Patients will tell doctor her symptoms and feelings. After that, the doctor will do some checkups and make diagnosis and to decide whether there's a need for taking medicines. If medicines are needed for patients, doctors will consider what types of drugs should be dispensed to patients and write down the name and the amount of that drugs on the medical record card. Then the nurse will get the medical record card from the doctor and give it to the drugs dispensers. When they receive the medical record card, the drugs dispenser will gather the correct types and amounts of medicines according to the writings by the doctors. Oops! An accident happened. The pharmacy is too messy. After that, the drugs dispensers bring the drugs to the reception and try to explain the usage of drugs to the patient. However, it seems that the patient is impatient as she has waited for a long period of time. Finally, the dispenser will dispense the drugs to the patient. In this business process flow, there are two fail points. The first one is that the dispensers need to spend a lot of time to recognize the words written by the doctor due to the poor handwriting. Another fail point is that the pharmacy is so messy, especially at the peak hours. The bottleneck in this process flow is that the dispensers need to spend more time confirming the drugs with the doctors, as the drug dispensers find it hard to read and understand the writings on the medical record card. Our manager has decided a new drugs dispensing system, which eases this bottleneck. Once again, patients will go to the doctor's consulting room, and the doctor will do some checkups and diagnosis. When the doctor wants to dispense the drugs to the patient, she does not need to write down the name of drugs on the card. The doctor will use a new drug dispensing system by using PC. Firstly, we will classify the types of drugs depends on their functions. Example, criteria A refer to fever and influenza. Criteria B refer to viral diseases. The table is like this. If the doctor wants to dispense this to the patients, he or she can just type A1 in the PC. Again, if he or she wants to dispense this to the patients, he or she can just type A2 in the PC. The dispensers will wait in the pharmacy, and all the data will be immediately transported to the pharmacy's PC. As for the pharmacy, we implemented another OM technique, which is operation sequence analysis. We will rearrange the cabinets and boxes in the pharmacy like this. We would like to put some high-demand drugs as close as possible. For example, A1 is antipyretic, and B1 is painkiller, which are very common and high demand for patients. We will rearrange boxes which store these two drugs as close as possible. This can minimize the total traveling distance and flow amount, and do not need the dispensers to walk around to get these drugs. This too means we streamline the whole process and reduce the bottleneck. The cycle time will be decreased since the dispensers do not need to recognize the doctor's words again. Moreover, the pharmacy will be less messy thanks to operations sequence analysis. Therefore, the patients do not need to wait for so long time now.